And the DEA is warning of the deadliest drug threat the U.S. has ever faced. Agents say they seized more than 16 kilos of fentanyl powder and 60,000 fentanyl pills in May and are still working to break up other drug trafficking rings. ABC News medical correspondent Dr. Darian Sutton joins me now for more on what parents should know. Dr. Sutton, how is the fentanyl crisis affecting families across the country?
I think it's affecting families across the country because it's something that many don't realize the threat that exists with the medications and the substances that they're using that are illicit. When you look at these numbers, they're concerning. Over 115 million pills in 2023, a quadruple increase from 2022. And many patients in the emergency room, often in my experience with patients who suffer from an overdose, simply report that they did not realize the threat that existed. A lot of these medications have been, fentanyl has been added to them to increase the potency. Fentanyl is something that is cheap to buy, cheap to make, easily accessible, and extremely dangerous. 1 milligram, a fraction of a raindrop, can be deadly.
So what can people do to protect themselves and their families?
I think first and foremost, understand the risk that exists with the risk that exists with using illicit substances, and also the signs of an opiate overdose, which can include unresponsiveness, pinpoint pupils, delayed response overall, slowed breathing, and also just simply understanding what to do next. You know, there are resources available that you can utilize if you're concerned about addiction or substance use behavior, but also simply being aware of the existence of Narcan. This is an intranasal medication, a nasal spray that is accessible and available in pharmacies without a prescription. And I think every first aid kit should have it, to be quite honest. And you can use it while you're waiting for 911, and it can help reverse the effects of an opiate overdose.
All right, ABC News medical correspondent Dr. Darian Sutton, thank you.